The Phenomenon of Child Sexual Abuse by Lisa Winkler. Definition: any interaction between a child and an adult or another child in which the child is used for the sexual stimulation of the perpetrator of an abuser. Sexual abuse comes in many forms and can include both touching and non-touching. Non-touching includes trying to look at a child's naked body, exhibitionism, or exposing the child to pornography. Research shows that child sexual abuse has serious impacts on both physical and mental health, as well as sexually related issues later in life. Children who have suffered a lot of trauma in their life and who have received little support are likely to develop PTSD, post-traumatic stress disorder, depression, and or anxiety. Their ability to trust adults to protect them and to care for them may also be compromised. Quote, abuse is like a boomerang. If you don't deal with it, it can come back to hurt you. Risk factors that can make a child vulnerable to sexual abuse: being a girl, unaccompanied children, children in foster care, adopted children or stepchildren, physically or mentally handicapped children, history of past abuse, poverty, war and armed conflict, psychological or cognitive vulnerability, single parent homes or broken homes, social isolation, parent or parents with mental illness or alcohol or drug dependency. Physical signs that a child has been sexually abused: bleeding, bruising, swelling in genital areas, bloody, torn, or stained underclothes, difficulty walking or sitting, frequent urinary or yeast infections, pain, itching, or burning in the genital area. Behavioral signs that a child has been sexually abused: changes in hygiene, such as refusing to bathe or bathing excessively, developing phobias, exhibit signs of depression or post-traumatic stress disorder, express suicidal thoughts, especially in adolescence, has trouble in school, such as absences or drops in grades, inappropriate sexual knowledge or behaviors, nightmares, or bedwetting, overly protective and concerned for siblings or assumes a caretaker role, returns to regressive behaviors such as thumb sucking, runs away from home or school, self-harms, shrinks away, or seems threatened by physical contact. The U.S. Department of Health and Human Services Children's Bureau report 9.2% of victimized children were sexually assaulted. Statistics show that 1 in 5 girls and 1 in 20 boys is a victim of child sexual abuse. Self-report studies show that 20% of adult females and 5 to 10% of adult males recall a childhood sexual assault or sexual abuse incident. During a 1-year period in the U.S., 16% of youth ages 14 to 17 had been sexually victimized. Over the course of their lifetime, 28% of U.S. youth ages 14 to 17 had been sexually victimized. Children are most vulnerable to CSA between the ages of 7 and 13. Symptoms to look for: an increase in nightmares and or other sleeping difficulties, withdrawn behavior, angry outbursts, anxiety, depression, not wanting to be left alone with a particular individual, sexual knowledge, language, and or behaviors that are inappropriate for the child's age. Evaluating children requires special skills and techniques in taking down the child's history, forensic interviewing, and examination. Abusers are typically known and trusted caregivers. This can occur over many weeks or years, becoming more and more invasive as time goes on. Why are men more often perpetrators? It's believed that men in our culture are socialized more towards seeing sexuality as focused on sexual acts rather than as a part of an emotional relationship. Cognitive behavioral therapy is available and effective in treating adults with PTSD following child sexual abuse. In summary, child sexual abuse is rarely physically forced but more commonly manipulated. Impacts of childhood trauma can have a dramatic effect on a child's life, such as brain development, physical and mental health, education, and behavior. There is no foolproof way to prevent child sexual abuse. However, being involved in your child's life and knowing the people they are exposed to can help, as well as knowing what signs to look for, and arming your child with the information and the ability to advocate for themselves can certainly lessen the risk of sexual child abuse. This is a crisis that cannot be overlooked. Children must be protected by us all.